Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And on today's episode of Skin School, we're going to talk about a very important and very personal topic that is near and dear to my heart, which is sun protection, melasma, all these things, because my wife has literally been dealing with and managing melasma for the last 15 plus years, and I've learned through a lot of the trial and error and a lot of the things that she has personally gone through. I've learned some very, very important lessons, and I want to share them with you so that you can benefit from them and hopefully get your melasma under control, as well as stop doing certain things that are either making it a lot worse or, more importantly, not making it better, which is fundamentally the same as making it worse. All right, so let's break it down. The lessons that I've learned, and I'm going to share two quick stories with you that will put this into context. So we had a very, very close family friend of ours that really, at the end of the day, suffered from one of the most extreme cases of melasma that I've ever seen. I took her under my wings, took her into the practice, and really, really tried hard. I'm talking about like every possible treatment that we had in our toolbox to help her with her melasma. I put her on hydroquinone, I put her on the Zeo hyperpigmentation system and kit, which included hydroquinone. I put her on, a routine of chemical peels. I did different types of lasers, microneedling, you name it, I did it. And what we did by the time the year went by is we made some pretty solid improvements. In fact, it wasn't perfect, but it definitely, if you put the before and afters next to each other, I kind of would have looked like a hero. And I would have liked to feel like a hero if it wasn't for the weekend. And here's what happened. This patient of mine goes off and decides to spend the weekend taking her son to Knott's Berry Farm, which is a theme park here in Southern California. Was there for 2 straight days. She came back Monday, contacts me and says, the melasma is back. It's as bad as it's ever been. What's going on? What's happening? She was all distraught. She comes and sees me, and sure enough, we're back to square one, like literally exactly the same melasma that she had before we did literally a year's worth of dedicated treatments. What happened was she was in the sun without, hardcore sun protection, and sure enough, boom, everything, gets reverted in 1 weekend. It was a lesson for me. It was also something that I've heard from patients over and over again over the years, because I literally have treated thousands of patients for this, and it became clear to me that how powerful this relationship between sun is and melasma. The second observation came from my wife, who, as I mentioned, has been dealing with melasma through hormone replacement and birth control pills pretty much since her 20s and 30s. And she's 52 now, by the way. And what we ended up realizing was in the last 2 or 3 years, her skin looks unbelievable. Like you literally cannot see melasma on her skin. I mean, it's the best it's ever looked. So you say, what has she done in this period of time, this last 2 or 3 years or whatever it's been, that has made this kind of an impact? There's 2 lifestyle changes, which I'm going to talk about here as I go through the list, that she has done that is truly, I feel, has been responsible for the level of improvement and the consistency of keeping her melasma down. Okay, and I'm going to go through this, so you definitely want to go through this with me one by one. I'm going to give you 5 tips on this topic related to sun, as well as one of them that's related to treatment. All right, so here's how it goes. Number 1, most important thing you can do is sun protection. And sun protection, as far as I'm concerned, starts with sunblock. Now, there's a lot of different sunblocks out there. There's a lot of different choices, and it's difficult sometimes to know what you need to do. But I'm going to give it to you. Basically, everything I'm sharing with you right here is literally what my wife does. Okay, so if it's good enough for her, hopefully you agree it's good enough for you. But this is what happens. So Elta MD is the particular brand. There's a lot of different sunblocks that fit this category. This just happens to be the one that we have used, so I can speak to it and I can endorse it from this point of view. But there's some features of this that I think are important. Number 1, this is a broad spectrum sunblock. Broad spectrum means that it covers both UVA and UVB of the electromagnetic spectrum. So that's very important. These are different parts of the spectrum. UVA is aging and the others skin cancers and sunburns. The key here is that it's broad spectrum, because any type of sunscreen you want to put on, you want to basically block both UVA and UVB light. Very important. The other components that I think are important here is that it's water resistance for up to like 40 minutes. So if you're out sweating, if you're out in the lake, you're out in the ocean, you're getting some sun protection despite that. And you know that after about 40 something minutes, it's time to reapply. The other aspect of it is that it's mineral-based. There's not tons of chemicals in it. In fact, when you look at the active ingredients, it's basically two. It's titanium dioxide at a level of 7%. Titanium is a metal, as well as zinc is also a metal. Zinc oxide at 9%. 7 and 9% of both those of minerals, and ultimately what it's doing is it's creating like a barrier to the skin, which is very, very important. The other aspects that I really like about this particular one is that it has a bit of a tinted finish. So for those who have a little bit of a darker complexion, or if you just want to use it as some type of almost like a foundation, it has that quality to it because it goes on very smooth, and you can even put makeup over it. But at the very least, if you don't want to put makeup over it, it doesn't look like you've got this white zinc looking thing on your skin. Very, very key. And it's an SPF of 41. And I think anything over 30 is a good SPF to be at. Elta makes a bunch of them. Again, so does a lot of other companies, but these are the qualities that I want you to look for. Next, let's talk about when you do put on a sunblock, how often should you be putting it on? So this is another one of those things that I think is really important. People sometimes put it on once, leave the house, and they're like, okay, I'm being really good with it. And that's the last time they put it on. Then they spend the rest of the day, out and about in the sun on the weekends and this and that. You gotta take the sucker to wherever you go, stick it in your purse, your backpack, whatever it is, and reapply every 2 to 3 hours. It's important because the SPF is just a period of time where it gives you protection. After that point, you're not getting protected. So if it runs out of protection, it's like you have nothing on your skin. So keep in mind, if you're exposed to a lot of sun, you're gonna be outside all the time. 2 to 3 hours, reapply, very important. So that reapplication is something I feel a lot of people are missing. Number 3, and this is where it gets really funny. This is the third point that I want to make, but I think it's the number one thing that my wife started to do, which really had a major impact on her skin. And it sort of happened by accident because a friend of hers, I did a vertical restore and a laser treatment, and she wanted to continue walking and doing all those kind of things outdoor. And I told her, you can't do that after a laser for some time and your incisions, etc. So she went out and got this. You're like, what is this? This is a SPF mask that is made by Bar. Now, what it is basically you cover here, right? It's breathable. It covers your neck and it covers your décolleté, kind of like a gator would, but the beauty of it is that it protects the face. Now, doesn't protect your forehead, doesn't protect this area, so what do? You use an SPF hat. This SPF hat covers all those other areas, and you're basically living in shade. Like there's no sun getting on your face. So underneath this, you put on your sunblock, you put this on, and you're good to go. And you're like, oh my God, Dr. Karam, this looks so stupid. There's no way I would wear this. Well, maybe you will, maybe you won't. My wife wears this every single day. She knows it looks funny and she knows it isn't like the cutest look, but she's in the sun literally every single day. She goes on a long walk, 1.5 to 2 hours in the mornings. She's out and about. She's not a moment that she's in the sun without this thing during the day. Now, the only times that she will skip this is if it's an important social situation. Other than that, she doesn't care. And she shouldn't, because why do you care? You're out on a hike, you're on a walk, whatever it is, like who cares what you look like in that situation? But here's the deal. You do this so in the evenings, when you take off your mask and you take off your hat and you take off the sunscreen and you're ready to go, your skin looks great. Now, the bonus of this is sun exposure is the #1 cause of skin aging, period. So protecting your skin from the sun is extremely, extremely important no matter what from an anti-aging point of view. So this gives you kind of like a dual benefit of it. So does a sunblock. So there you go. This might be the step that you're most reluctant to doing because maybe you're a little self-conscious of wearing such a goofy looking attire when you go out. But at the end of the day, good news is if you're wearing this, no one's gonna recognize you anyway. The fourth thing is seek shade. People don't realize how much your decision about where shade is on a walk or where shade is on a picnic or where shade is, an event or whatever, you have a lot of choices there. A lot of times, I'm walking with my wife and she's like zigzagging me through the streets, with this side and that side. I don't even realize what's going on. And I realize it's because that side of the street has more shade, this side has less shade. And she's, navigating and trying to keep as much shade, on the walk, for example, as possible. If you're at an event, you go under the shade, under a trellis or an umbrella or whatever it is, you can find shade in most places. Try to use them. Look for it. Seek it. Very important. All for the same reasons. Number 5, this is the 5th thing that I believe my wife has done that has made a big difference. Remember I told you in the beginning, she was using hydroquinone, she was using all these things. She's always been on retinol, she's always been on vitamin C, she's always been on a lot of very good skincare, mostly like Skin Medica and Azeo and Obagi and all these guys, because in my medical practice, my surgical practice, this is what we carried, and they're solid products. But it ended up being like 8 or 10 steps for her, which was a lot of steps for a lot of people. But it was also my motivation because I saw how much her skin improved. It was the reason why I developed the trifecta. Basically, what my initial intention was, I said 8 steps is too much for most of my patients. If I put it all together in 3 steps, exactly the same combination of things, that it would be more likely that they would stick with it, like my wife has stuck with it, and as a result, they will benefit from the anti-aging effects on their skin. That was the intention and the story behind the trifecta. So here's the trifecta. Step 1 is rinse, which is a cleanser. Really important to have a clean skin palette when you go onto it. Number 2 is quench, which is a vitamin C. This is your antioxidant step. It's like a very potent triple vitamin C antioxidant component. It's step 2. And this is the one that is extremely important in addition to quench when it comes to melasma, because this is why. And remember, I didn't develop this for melasma, but I'm going to tell you the story of how it ended up becoming a very logical thing to use for hyperpigmentation or melasma. In here is retinol, in here is vitamin C, more vitamin C. It's niacinamide, in addition to a number of botanical or plant-based pigment reducers, basically things that are decreasing the production of pigmentation, we call them non-hydroquinone lighteners. The story of why melasma forms in the first place, it could be, and I have several different videos that show and go into depth on why melasma forms and the science behind it, etc. But suffice it to say, there's something that's causing the melanocytes to produce a bunch of pigment, and they form in clusters in your forehead, your cheeks, etc. So if you can suppress the production of melanin, which is the reason why hydroquinone exists, if you can suppress the production of melanin, well, guess what? You're not going to produce melanin, you're not going to produce pigment. If you can decrease the production of it from a stimulation point of view, e.g. the sun, if you can decrease the production of it, you're going to produce less pigment too. You're going to stimulate less. So between sun protection and the topicals that go on that suppress the production or inhibit the production of melanin, you're hitting it at both sides. Now the problem with hydroquinone is you can't be on it for more than 3 to 6 months at a time, so you're cycling between them, and many of you who've used it know this. So what happens in between the time when you're off? Well, your skin is being uninhibited and it's producing pigment, and then you knock it down again. The beauty of non-hydroquinone lighteners is that you can stay on them consistently over time. And I didn't realize this. I wanted something that decreased sun spots and pigment and even up the skin tone. That's why all those things are in here. But it wasn't until afterwards, when my wife started to move away from her 8-step routine and started doing the trifecta, totally organically, by the way, her skin started to improve from a melasma point of view, in addition, obviously, to her overall skin condition, but her melasma started getting better. And then I started looking at and understanding melasma a little bit deeper, and I understood that if you can suppress, with all the things that are in here, which happen to be in here, you're getting benefits of suppression, and of course the physical stuff that you do with hats and masks and sunblock, you're all around attacking it from all different sides. So I started hearing this from other patients, and I started seeing this on our clinical studies, that it decreases pigmentation, improves tone, and now it makes sense. But bottom line is, because of the consistency of the use of it, you're able to stay with it and continue to diminish it. But I will say this, even with the strongest and best topicals that you put on your skin, I believe that if you were to go out and spend a weekend like that person I mentioned in the sun, or a full day on a boat, or whatever it is, and just bake in the sun and get it all over you, I bet you your melasma is going to get worse. And I think it's important to realize when you have melasma, you need to think of it as either you're going to go all in and really try to make a major impact in it, or you're just going to basically live with it and use cover up and different things like that. But one thing I don't want you to believe is going to totally be worth your time and money is the in-office treatments that, again, I talk about in a lot of the different melasma videos that I put out there, but really it just doesn't make sense. It doesn't address it. In some cases, when my wife and I were just talking about this actually last week, that many of them that we tried with her actually made her melasma worse. And again, in retrospect, looking at it, it makes sense why that happened. I really, really hope this video gives you some hope and inspiration to do the right things for your melasma from a sun protection point of view, as well as from a skincare point of view. And like I said, I mean, if you don't want to use the trifecta, certainly don't, but make sure that the components in there that do suppress melanin and improve the function of the melanocytes are in your routine, because that is a very important part. And I think, you know, I can feel comfortable expressing all of this to you because I've lived it and I've seen it, not just with my wife, but also with many patients along the journeys that they've taken as well. It's a pleasure to share this with you. If you haven't already, please make sure that you sign up for this channel, videos like this, videos related to anti-aging, as well as our newsletter, the Karam MD Journal, give you power to know what to do, know what not to do, and keep yourself on a good path moving forward and meeting your goals. If you enjoyed it, hit like. If you have any questions, drop them in the comments below, or if you want to share your personal anecdotes or stories, I'd love to see them. And we can all learn from each other's errors, as well as things that you may be aware of that I'm not aware of in your own personal journeys with melasma. And share it, and let's move on and get to the next video. I hope you all have found this to be as interesting and as important as I believe you will. Thank you so much, Dr. Amir Karam.